Once the CPET equipment has been prepped, the next step is to collect 55 cc's of whole blood into the 60 cc syringe that was previously filled with the 5 cc's of anticoagulant. The access site, needle bore, and use of a butterfly are at the discretion of the clinician. The goal, however, is to collect blood as quickly as possible to avoid clotting. The preferred site for the stick is the jugular vein. When the jugular is difficult to access, the saphenous or cephalic veins are also acceptable collection sites, although they will take longer to collect the blood. When accessing sites other than the jugular, using a butterfly is recommended to facilitate adequate mixing during collection and thereby avoid clotting. Now, you'll introduce the 60 cc solution of anticoagulated whole blood into the filtration system. Remove the cap on port A and transfer the anticoagulated whole blood to the top bag, gently rocking the bag and mixing it with the capture solution. When the transfer is done, remove the syringe and replace the cap on port A. Remove the CPET system from its hanging position and continue to mix the blood and capture solution by inverting the bag, a minimum of 10 times. Good results here require that the blood sample and the capture solution are well mixed. Once that's done, rehang the CPET system in the same vertical position as before, making sure the top bag is above the filter and the arrow on the filter points down. Ensure the tubing is not crimped and that the path is clear for blood flow. Open the clamps above and below the filter, allowing the blood to flow through the filter into the lower bag. The filtration process should take between 5 and 15 minutes. The filtration is complete when the flow has stopped and the unprinted side of the filter has drained. Now we're ready to recover the platelet therapy. First, close both the top and bottom clamps. Next, prepare the harvest solution from the vial with the white cap. Fill one of the 10 cc syringes with 8 cc's of the harvest solution. The platelets will be collected in the remaining 10 cc syringe. And this final syringe should be kept sterile for the delivery of the platelet therapy. Remove the cap from port C and attach the syringe with the harvest solution. Take the final sterile syringe and depress the plunger to remove any excess air, then attach it to port B. Holding the filter with one hand, inject the harvest solution through the filter with constant pressure. This should only take a few seconds. If the pressure is too great and the plunger doesn't depress easily, stop. Remove both syringes, reattach, and then inject the harvest solution through the filter. The contents of the filter will backflush to port B, and you will approximately receive 6 to 8 cc's of final product. This is the platelet therapy. It's now ready for use and should be administered as soon as possible. The final step in the canine platelet enhancement therapy is the intra-articular injection of the platelet preparation near the site of the injury or disease.